Hello, my name is Dr. Eshwar Ramadas. Most people call me Ish. I'm a primary care physician with the TriHealth Primary Care Institute. So I chose to practice family medicine and do primary care because that really allows me to spend the most time with my patients. If I get to know more about someone's family life, their work life, their home life, their hobbies, that helps me hopefully lead them to an active, healthy lifestyle, and then we can hopefully prevent any progression to any serious illnesses or anything. To me, prevention is the most important part of primary care. Whether we're talking about diet or exercise or weight loss or mental health, I truly believe that if we can optimize these areas of someone's life, that's more important than any medication I could possibly prescribe. As a primary care physician, we do treat multiple conditions, whether it's diabetes, high blood pressure, headaches, back pain, foot pain, so we really are important in treating all of those. So much of what we do is listening and extrapolating that information to try and help our patients. So you have to make sure that your doctor is really listening to what you say. And if there is some kind of barrier between you and your primary care physician, just bring it up to them and you can see if you can hopefully break down that barrier to improve your health. I'd recommend seeing your primary care doctor at least once per year for an annual physical. We can just see if there's any big changes, any medication changes, if there's any big life changes that could be affecting how you're doing. If you have some chronic medical conditions, it might be better to see them more frequently, like every 6 months. And then if you have some uncontrolled medical conditions, it might be even more frequently, like every 2 to 3 months. The best part of my job is to help people who put their trust in me to do so. Whenever I see someone who's really changed their lifestyle around to make it healthier, or I see someone who's beat some kind of severe illness, I really know that I chose the right field of medicine. In addition to that, being born and raised in Cincinnati, being able to serve the community that I grew up in is a really humbling and awesome experience for me. I'd be more than happy to see you in my office. We can talk about your past, your present, your future, and see where you're going. When you come see me in the office, it'll probably be a quite thorough experience. We'll go through all your past medical history, but I'll really try to delve into your personal life and see what makes you tick. And by the end of the visit, hopefully we can come up with a plan that will either help whatever acute problem you had, or we can just make sure that you're staying on the right track with how you're doing right now.